Welcome into this video. Here's a short clip from our podcast. Then, as you submit for that job, which really means your recruiter is going to send over your resume, if the facility that they send the resume to is interested in having you as a therapist there or a nurse there, they will offer you an interview. They will reach back out to your recruiter, and your recruiter will reach out to you and say, hey, they've offered an interview. And then your recruiter is the person who you're going to talk to set up a time with that facility. Mm-hmm. So a lot of times when facilities or hospitals offer a interview to you, they'll also give you like, hey, we're available at these times. Would any of these work for you? Mm-hmm. And so once you say, yes, I'd love it to take the interview, then you can set up a time.
And taking the interview still does not mean that you're taking the job. This is your time to kind of check out the facility and see if it's a place that you're interested in going to. The next step is actually doing the interview. It's typically a phone interview. And like we said, there's a time that's set up between you and your recruiter, and then the recruiter sets up the time between you and the facility. So you're not talking directly to the facility until this interview. And we actually have a PDF list of like the 10 best questions to ask in an interview, and we can pull that up and kind of go through it right now.
Right. Yeah. This PDF is super helpful. These are the 10 questions we always ask. We ask more questions than 10, but these are the 10 most important questions to ask because, again, this interview is very different than how your permanent interviews go. You are interviewing the facility to find out, do I want to sign on that contract and go work for them? Mm-hmm. Because at any point, if you get a bad vibe from the interview, you can say, nope, I don't want to work there. Recruiter, please look for another job.
Do you want to pull that up?
Yeah.
And while Ryan is pulling that up, I'll just kind of go through a couple things that are on the top of my head that we always ask, just to kind of help give you a few ideas of what this interview is and what the important things to look for are. Typically, we get on and you're talking with like the manager, somebody who's going to be hiring you. They might have a couple questions for you. Usually they're not very in-depth. They can be, but usually they aren't. But they want to know a little bit about your background, who you are, how long you've been working, kind of what settings you like to work in. But typically, they'll give you a chance to ask questions about their facility. We normally ask about the patient population to kind of figure out, what type of patients they are seeing. This might be, pediatric, might be a mix. It might be, elderly, could be ortho, all different types of things. They'll kind of give you an idea of what you're going to be seeing. That can help you determine if, I'm used to seeing that patient population and I'm great at it. Or maybe you're not. Like if somebody told me I was going to see a lot of pediatric patients, I would say, I'm going to probably need more onboarding time because I haven't worked a ton with that population. So you're going to ask about patient population. Then you'll probably ask about who your coworkers are going to be. If they have any other therapists on staff or nurses, whatever support staff you're going to be looking for. Because if you're a new grad and you're going into a location that has no other therapists, that might be a hard first travel contract to take because you won't have any support at the location. So we always ask that, especially as a new grad. And then also just as a traveler, it's nice to have, at least one other person there to kind of help you get acclimated to the location and figure out how things work there.
I wasn't listening too much, so stop me if I repeat, but these are 10 kind of questions we always ask. I will have the free PDF download down in the description, so just click that link down there. That'll take you to a place where you can download this PDF, so you can have it in front of you like we're using now when you're on that interview, because most likely that interview will be a phone interview. Sometimes they do it over Skype or Zoom. This most likely will be a phone interview, so you can have these questions in front of you so you don't forget to ask. Mm-hmm. So the first one we have on here is about productivity. How is the productivity determined? And what is your expectation once operating at full capacity? So this is an awesome question to ask because you want to know how is the facility going to rate if you're doing a good job or not. Mm-hmm. And you also want to know how busy is that clinic. There might be a reason why they need travelers there is because they can't keep permanent staff people there if their productivity is way too high. So you want to know what their productivity is, how many visits are they seeing per day in your 8-hour, 10-hour day. And then when you are up to speed, so orientation's done, what is that capacity that you're looking at?
Well, the next question on the PDF is support staff. So we already talked about that. But the question after that is orientation. And
I think I'm going to stop you there. I think one thing for the support staff that I will say is if you're a therapist and you work with assistants, so like physical therapy assistants, occupational therapy assistants, it's good to know, like, are you going to be managing one PTA, no PTAs, or like too many PTAs? And so you need to ask, like, not only like, is there other therapists around me that I can ask questions on and feel supported by, but are there going to be assistants that I'm in charge of and how I'm going to do that? And then also, you want to know your other interdisciplinary things, like, is there OTs, SLPs, nurses you're going to be working with, just to get a lay of the land.
So the next question is about the orientation. So that kind of relates to that first one we were talking about with your productivity. What are you expected to be at full capacity? Well, you also need to know, when are you expected to be at full capacity? You need to ask about how long is the orientation process? What is it like? Am I going to have somebody that I'm working with and can shadow, and find out if it's a reasonable timeline for you? If you've been in this setting before and you're really comfortable with it, you might be orienting for 1 or 2 days. If you've never worked in this setting before and you're not comfortable with it, you might need to ask for a week or 2.
And this is the time to get those orientation details, because facilities, a lot of places, they'll just brush over it. They'll just say, yep, we'll have orientation, we'll get you up to speed, and they leave it at that. No, you want to know the details. What does this process look like? How long does it take? What are the steps? Am I going to be riding along with someone, shadowing someone? How many days do I shadow? How many days do I go kind of at half capacity? And then when is my ramp up? So you want to get those details and ask those questions on this interview so you know what that's going to look like and you have something you can hold them to. Because sometimes you ask this question and they don't know.
Yeah.
They don't know what the orientation is going to look like. And then that kind of puts it on them to say, hey, you guys got to get your stuff in order. If you don't know like how long it's going to be or what that looks like or who's going to be training me, these are questions I would like to know before I would even be willing to sign a contract. And then once you have it set, then you know, okay, hey, it's going to be 5 days. The first 2 days are shadowing. Then I'm going to kind of go see a few patients that next day and then have 2 days full with a little bit of backup. And then you have something to look forward to, something to plan around, and you feel less anxiety of, are you going quick enough?
And it's also a good time to kind of establish if you think you're going to need a little bit more time to ramp up and they're expecting 2 days. Well, you need to let them know, hey, I haven't ever been in this setting before. It sounds like I'd really like to work here, but I might need a little bit extra time. Are you willing to work with that?
So the next question we like to ask is about the documentation. So we usually ask, what documentation system is used at your facility, and is there scheduled documentation time? So we want to know, like, do you use Epic? Do you use Raintree? Like the actual EMR that they are using, what do you use? Am I familiar with it? They're probably going to want to know, are you familiar with it? That's a bonus for you. And that just brings a little thought to mind. When you write up your resume, this is what's being sent to the facility. We have on our resume all of the EMRs that we have ever used. That we are familiar with. Maybe we'll need a little crash course to knock off some rust if we haven't used it in a while, but it's really great to add those EMRs on there, because if this job uses one of those EMRs, they see that and that gives you a little bonus point for that facility to give you an interview. So something to think about when you're doing your resume. But you want to know what documentation system they're using. And then you want to know, is there scheduled documentation time for you to complete that?
We're big about not documenting off the clock, because it is a liability for you to take and for the travel company to take on if you are documenting off the clock. And also, it's unpaid work, which is the liability. So we're very big about, establishing, hey, there should be documentation time on the clock, and establishing that you're not going to be documenting while you're off the clock.
That's one of our big things. So many times we go into places and the therapists there are all documenting like an hour or two after work, unpaid, or they're salaried. So they're just putting in extra work. And that kind of creates a bad habit of that's what now the facility expects you to see this many patients and then do all this documentation at home. And we like to try to break that the best we can as travelers who come in temporarily. And so we're pretty direct on, hey, our travel company doesn't want us to document off the clock. Here are the ways that we are being as efficient as possible with our documentation. So there is some of that to consider. If there's ways that you can be more efficient with your documentation, then you need to take that constructive criticism from the facility. So own that a little bit, but there should never be a point where you're just doing an hour or two after work unpaid of documentation.
As far as other questions goes during the interview, we like to call the last one the general nitty gritty, getting the idea of what's going to exactly be happening while you're there. So this can include, what exact hours are you expecting me to work? Are there going to be any weekend shifts? Am I ever going to be on call? Is it 10-hour days or 8-hour days?
What's the dress code? So do you have to wear scrubs? Is this a business casual, khakis and a polo? How much time is allotted for each visit? So for us, we want to know, do I have an hour to do an eval? Do I have an hour and a half? And then for my treatment times, is it only 30 minutes or do I have a full 45 to an hour? So you want to know, what is the allotted amount for those appointment times?
And then it's also good to know if you're going to be following patients through their episode of care, because sometimes they bring you on just because they need to get more patients started and they have a staff that's already there to kind of treat, or they have PTAs, assistants there to treat. And so you can kind of get an idea of what your role is going to be and what they need you to do while you're at their facility.
Usually the facility is pretty honest about that one, which is really nice. And I actually don't mind it too much, because sometimes they'll bring you in and they say, hey, we really have a lot of initial evaluations we need you to do, and we're going to then give it off to your PTAs to do most of the treatments. And so this is why we're bringing you in. And now I have a little bit of a vision from them, a game plan of, okay, I'm going to come in, I'm going to do some evals, and I'm going to help them in that area. And that always makes me feel better than if I show up and I'm like, man, I'm just getting swamped by evals. I never get to see people. I'm a little bit more aware of what they're desiring.
And then we've got a bonus question on our PDF. Should we leave that a little secret and have people?
No, give it to the people.
Oh, he's so nice. So our bonus question that we think can help you stand out as a traveler is to ask them, how can I be the best traveler for you? With this question, they know you're serious about really helping them out. You want to come in and show them that you're capable of, solving this immediate problem that the facility is having.
And their feedback is so valuable to that question, because if you listen well, they are going to tell you exactly what they need you for. And they're probably going to be very honest. So they might be like, hey, we just have a lot more patients than we have therapists, and we need someone to come in here and help ease the caseload for our other therapists. So then you know what your role is. And it looks good on your interview to say, how can I be the best traveler for you? But really utilize that answer that they give you so you can impress, because you want to be good. We don't want to just be travelers that come in and make more money and then we're not good at our job. We want to be good therapists. We want to be good nurses, and we want to come in there and be of assistance to our fellow coworkers and to the facility. And so this is one of those that we can get a good answer from on what we need to do.
So that's a little overview of some of the really important questions we like to make sure and hit when we are in that interview. And then as far as what to expect at the end of the interview, do not expect to give the person who's interviewing you an answer as to whether you are going to take the job or not. They might ask, but really it's not appropriate to tell them. It's more appropriate to communicate it to your recruiter. So you can say, hey, I would love to just review over the details of what we talked about during our interview. I'll get back with my recruiter and they can get with you, on what we're thinking.
Right. Be nice. Thank them for the interview. Say, hey, this does look like a really great place to work. I'm very excited about it. Let me think about it, consult my recruiter, and they will be getting back to you. But don't accept the job right there on the interview, even though you might feel a little pressure too. Thank you for watching this short clip of our video podcast. If you enjoyed this, please consider hitting that like button, consider subscribing. And if you're interested in learning more about this travel lifestyle, think about watching another one of our videos here.